Welcome to Medical News. This is Jessica West, broadcasting from KCON. I'm here with Kathy Wilsey-Ankeny from that's going to explain about her new product that's called PHEP, and it's a personal health education plan. Thank you for coming.
You're welcome. I appreciate you having me.
Well, so tell me about, you've got this product. Tell me about what the problem, why you developed this product.
Well, we realized that we had a need for this comprehensive, streamlined, concise information to give to the patient so that they can make healthy self-care choices on their discharge.
So at home and in the hospital.
So when they get to when they get home, they know how to take care of themselves. Because, nurses are doing the best job they can, but they have a limited amount of time. And often patients, they don't feel well when they're getting ready to go home still. Their cognitive abilities are not quite up to par, and you forget things when you get home. You lose that handout or whatever.
So this product is available to all populations. It doesn't matter what your age, culture, language, education level is?
That's correct.
Oh, that's fantastic.
I think even a preschooler can handle it.
Yeah, well, great. So what's the, tell me about the product. What is it?
All right, well, this one is a downloadable app that is linked to software that we've developed that is going to pull in and integrate all the electronic health information that you had while you were in the hospital. It's going to be linked to your medications, your diagnosis, your goals that you have set for yourself, the goals that they set for you in the hospital, just everything that you need to take care of yourself once you get home.
So then the education materials will be accessible anywhere.
That's absolutely right. So you would download this app either on your personal electronic device, or you would borrow one from the hospital. You would get, like an iPad or some kind of a pad device,
and
then
phone,
yes,
tablet.
whatever it is. And then you would take that home. You have your own account. You have your own password. It's very secure, and then you would be able to access at the push of a finger a video, a guide for nutrition, developing a plan for exercise. Whatever it is that is your need for whatever it is for you. You could pull up demonstration of how to give yourself an insulin shot or dress your wound or whatever it is that is your desire.
So when a patient is groggy in the hospital and they're not really taking in any information, they can get that information at home.
Absolutely. And
that's great.
And the beauty of it is that you don't have to remember it because you can go back to this time and time again as often as you need to.
And one of the other things that I was really fascinated with this product is that it's linked to the from the hospital to the patient, and then to the primary care physician and the specialist that they go to. So everybody has access to this information. That's
right. And so when you go to your follow-up appointment and you talk with your primary care physician or your specialist, and you reevaluate, is the plan working, is it not, and then you can tweak it.
Sounds like a great product. So what's the cost for this product?
Well, most of the cost comes with developing the software, of course, and then you're going to have to develop educational materials that go into the actual software, so that's a cost, and then training your healthcare staff, and then, of course, so that they can also train the patients. And then purchasing some of the electronic devices that are going to be loaned out.
Oh, okay. So there's a lot of costs that are up front, but then after a while, it's not quite as much.
Absolutely.
Seems like a great product. So what are the positive outcomes expected?
Well, the biggest thing is that we really predict that there are going to be a very much lower readmission rate of patients going back into the hospital. It's going to empower patients to have responsibility for their own care. And then they're going to improve the quality of life.
That's great. So what about the downsides? Are there any downsides or limitations that you see?
Well, the only real downsides we see is that this human interaction, like you and I sitting next to each other, you won't have that. But it's kind of like having somebody sitting next to you, because you have, at the push of your finger, you've got videos and all kinds of neat things. We also hook you up with sort of online buddies where you have support with online groups. You can find people that have your same disease problems and sort of interact with them.
Seems like a great way to link people to other people and even if they have disability where they are stuck at home.
That's right, exactly.
That's great. So I was wondering about the informatics challenges. Is there any evidence-based research that addresses this?
Yeah, absolutely. In their book, The Essentials of Nursing Informatics, Saba and McCormick identified, the privacy and security and some legal issues that go into that. We don't want to violate any HIPAA rules, right? So we feel like this product is very safe. It's kind of like doing your home banking. You have your own account, and nobody can access it unless you want them to.
Well, it seems like you've addressed those challenges with this product.
We sure hope so.
Well, thank you so much, Kathy, for joining us on Medical News. We're excited that you developed this new product, and this should be coming to a hospital near you.
And you got a battery low right there, too.
I do. Wow, I know. I knew it was coming. Okay, let's see.